If you ask most people why we breathe, they'll say we inhale to bring in oxygen and we exhale to remove carbon dioxide. It's commonly believed that only oxygen is required for our health and that carbon dioxide is just a waste gas. The truth is that carbon dioxide is just as important for our health as oxygen is. We don't exhale to get rid of carbon dioxide. We exhale to regulate the amount of carbon dioxide in our bodies. There is an optimal amount of carbon dioxide that our bodies try to achieve. Too much or too little can be a problem. While carbon dioxide is tested on virtually every standard blood chemistry panel your doctor could order, few doctors understand exactly how to interpret it. Yes, high CO2 is a risk for lung damage and emphysema, but low CO2 is usually ignored. It's commonly assumed to be the result of someone being anxious at having their blood drawn and hyperventilating. True, this can happen, but more often than not, it really is low CO2, and most doctors have no idea what this means nor what to do about it. Before cyanobacteria filled our atmosphere with oxygen some 3 billion years ago, carbon dioxide was the cornerstone of Earth's primordial biochemistry, and many of these ancient biochemical pathways are still fundamental to our own metabolism today. Low CO2 causes a cascade of events in people, and the lower it goes, the worse the outcome. What does low CO2 cause? Lots of things, and it is different for different people. But in general, we will see fatigue and anxiety. These are the classic signs, but there are more. Before we get to these other signs, let's talk about how and why CO2 drops. For some, it is a pathological breathing problem, but for most, I think it is metal toxicity. Carbon dioxide has 3 forms in the body: carbon dioxide, carbonic acid, and bicarbonate. It shifts between these 3 forms as needed thanks to a set of enzymes called carbonic anhydrases. The issue is that these carbonic anhydrase enzymes require zinc to work, but other metals can also attach to the carbonic anhydrase enzymes. Mercury, cadmium, nickel, silver, even excess copper can do it. When this happens, the carbonic anhydrase enzyme can't shift CO2 to carbonic acid or bicarbonate. This causes the acid-base balance to go haywire. It wrecks digestion, since all digestive enzymes need bicarbonate to activate. It can cause gastritis, since the hydrochloric acid of the stomach can't be neutralized. It causes inflammation, since the spleen, which controls how inflammatory the immune system is, needs bicarbonates to calm down. This is just one set of examples in a single system of the body. What else can happen? Carbon dioxide is required for oxygen to jump off the red blood cells and go into the tissue. You can have perfect blood oxygen saturation levels, but still be hypoxic at the tissue level if you don't have enough carbon dioxide to keep the system in balance. Another job carbon dioxide has is to protect the proteins of the body. Almost every protein in the body has something called an amine group, and these amine groups are very sticky. Now, these sticky amine groups are supposed to stick to carbon dioxide. When they are, they're protected. But if there isn't enough carbon dioxide available to stick to them, they can stick to sugar in our bloodstream. Sugar attached to a protein is worse than useless. Now it's a waste product that has to be removed before it comes up the system. For those of you into anti-aging, this sugar reaction is called glycation and is one of the main causes of aging. Now let's look at 5 groups of proteins and see what can happen when they glycate and become unusable. Let's look at structural proteins, hormones, neurotransmitters, enzymes, and antibodies. Structural proteins are the proteins that we use to grow and repair ourselves. Take skin, for instance. Glycation of skin proteins like collagen and elastin lead to wrinkles and sagging skin. Hormones are chemical protein messengers that help the body communicate with itself. If you have normal hormone levels but symptoms of low hormones, it could be low carbon dioxide. Neurotransmitters are the protein chemicals the brain uses to think and to feel. Dopamine gives us drive and ambition. Serotonin gives us happiness and peace of mind. Melatonin helps us sleep and keeps our brain healthy. These are just a few examples. When these neurotransmitters glycate due to low carbon dioxide, not only do they keep us from being as smart and as happy as we can be, they also end up forming deposits in the brain itself. Now let's talk about digestive enzymes. Not only do we need carbon dioxide to activate our digestive enzymes and neutralize stomach acid, we need carbon dioxide to keep them from glycating and becoming useless as well. Antibodies are the proteins of our immune system. Carbon dioxide protects them, but also makes the white blood cells move faster. Carbon dioxide also helps them become more aggressive and attack better. It also helps white blood cells make more antibodies. In other words, carbon dioxide is completely required. In other words, carbon dioxide makes your immune system stronger and faster and better able to recognize infections. Carbon dioxide is also involved with more than just the protection of proteins. It's also involved with their removal as well. When a protein reaches the end of its useful life, it turns into ammonia. Now, when there's enough carbon dioxide available, ammonia combines with carbon dioxide to form urea, which is then harmlessly removed from the body. But when the carbon dioxide levels are in short supply, ammonia can build up. Some of the symptoms of ammonia toxicity include tremors, fatigue, and aversion to high-protein foods. If the ammonia levels get high enough, it can damage brain cells. The symptoms of ammonia toxicity are nearly identical to the symptoms of Parkinson's. I wonder how many people who are told they have Parkinson's actually have ammonia toxicity. And when you consider that one of the drugs for Parkinson's actually interacts with carbonic anhydrase, I think that's a clue. We make ammonia every day, and it's only carbon dioxide that stands between us and ammonia's damaging brain effects. Carbon dioxide is also a natural tranquilizer. When there's enough carbon dioxide at the body, muscles and nerves relax. When not, we tend to cramp up. It might be menstrual cramps, or muscle cramps, or angina, or if the cramps happen in the blood vessels of the scalp, it could be a migraine. Carbon dioxide is fundamental to our health, and while this talk isn't meant to be a complete teaching on carbon dioxide, I hope it conveys to you just how important it is to your health. Okay, how do you know if you have low carbon dioxide? If you have blood work, look for your carbon dioxide level. It'll say CO2. I consider 27 optimal. Over 27, and I look to see if there might be some lung damage. Maybe get a spirometer test, measure your lung function. You could consider alvectin, our product that supports the lungs. Below 26, and I'm thinking metal toxicity. At 25, you might just be tired. At 23, a person knows something is wrong. At 20, everyone else knows something's wrong with the person. And below 20, and that person's probably nearly completely dysfunctional. However, it doesn't always show up with the blood. Sometimes it only shows up in the saliva. Saliva pH should be 6.8. If it's below 6.6, something's definitely up. And below 6.4, and there's going to be some serious imbalances going on. CO2 creates symptoms that can be very hard to see on tests. The enzymes, antibodies, neurotransmitters, and hormones are there, but the person has symptoms like they're not, because they're glycated and aren't working properly. It can show up on blood work, but it is often ignored, and sometimes it won't show up on blood work, and you need to check the saliva pH to see the imbalance. People with low carbon dioxide are called lazy or hypochondriacs, but bring their carbon dioxide levels back to normal and their symptoms can improve and they get their energy and mood back. If you think or feel something's wrong, there is. Even if every test comes back normal, even if every doctor thinks you're fine. Low carbon dioxide gets into a vicious downward spiral with metal toxicity. The metals lower the ability of mitochondria to make carbon dioxide in the first place, and then interfere with carbonic anhydrase enzymes, so what little CO2 the person has isn't efficiently turned into carbonic acid or bicarbonate. This makes the urine more acidic, which means that even if you try to chelate out the metals, they can disassociate in the acidic urine, go back into the bloodstream, and then cause problems all over again. If you have low carbon dioxide levels, or think you might, or have metal toxicity, consider chelation. You could consider our Captamet, Dasamet, and Velamet products, along with our bicarbonate supplement to support bicarbonate levels while you're chelating. Low carbon dioxide is a sign you might have metal toxicity. While it can take 3 to 24 months to fully resolve, even within a month you might start feeling better. If you have any questions, feel free to call us. Take care.